Thank you, Ed. Can everybody hear me okay? By all means, ask questions. We have a lot of information this year. I'm not going to try to go over every line item today, but I'll give you a little backdrop of our drill. There's 2 hospitals that we're looking to have a CMS drill at the end of last year, Pullman Regional and Whitman Hospital Medical Center. And our public health department said that they were going to do a hazardous chemical fire exercise at our local landfill. And we're in. Let's do it. That'd work out great. So we could test our surge capacity and even our decontamination tent. The drill was set for middle of September, and in the first part of August, we were told that they had some personnel transfers and they were canceling the drill. So what that meant for our 2 hospitals, we still had to complete a drill to meet the CMS requirements for that year. And we decided as a group and as a county that we would develop our own drill. And one of our rural fire departments said, we've got this bus, and we would really like to cut the top out of it. Okay, do that. So between a couple fire departments and a couple hospitals, in probably less than 8 weeks, we organized the event, structured the event, and had the event. And it was pretty good. So this is a slideshow that'll talk to that a little bit. By all means, if you got any questions, ask. There is some, I'd like to think, pretty nice moulage in this, in case anybody's squeamish. Like I said, we had the full-size bus with 34 patients. Not all of them were live patients. The first time I've ever seen the blow-up gray triage black dolls, whatever they were called. Has anybody ever seen those before? They're kind of goofy looking. There's some up there. One of the biggest things that we have for takeaways this is we had 2 counties, one in Idaho and 2 states, Idaho and Washington, both come together regardless of the geopolitical stuff. We just came together, decided as a region this is what we wanted to do, and everybody just got on board with it. It was pretty nice. We had 14 agencies participating, like I say, from 3 different towns, 2 different counties, and everybody got along great. We had good communication from the process, and there was just no issues. Everybody's philosophy was, what do we need to do to make this happen? And it worked out real well. So we have a transit bus carrying 3 or 4 passengers, and I think it crashed because they were on the way to the WSU game. I don't know. So at the end of it, we had 24 passengers. We set that up ahead of time. We had 3 hospitals, and each one wanted to have 8 victims come to them, all at the same time as the surge, so we wouldn't get too overwhelmed. And I understand that the 3 hospitals probably had not done as many disaster drills as they could have over the years. So we wanted to kind of go into this kind of reasonably as well. So as a region, we wanted to figure out how we would respond to the MCI from dispatch to the hospital and evaluate communications, command and control, triage of the treatment. So this was in the morning. That's me applying moulage to one of our volunteers. I was pretty impressed by the number of people that wanted to be victims. It's kind of neat. The girl on your right, she's one of our roller derby dames that they call them from Moscow. So she was not pale like that. Naturally, it was all makeup. She was quite the gal. So for the hospitals, we wanted to definitely evaluate our communication process. Pullman is a DMCC for our region, and we wanted to make sure our communication was good, and we wanted to make sure that that was as early as we could get it to provide notification for our ED staff. For Pullman specifically, they wanted to know about the hospital-hospital communication, and they wanted to find out how their DMC could coordinate with Whitman, Idaho Hospital, or the hospital in Lewiston, because they are still within our transport area, depending on type of injuries. And for us, we had a new position, our incident or our clinical coordinator. A lot of facilities have those. Ours was pretty new at this point, and we wanted to evaluate how our training process was doing for our staff. And one of the things that we had to do repeatedly was to tell our staff, we are testing the process, not testing the staff, because everybody thought that they were going to be tested and that the evaluator was going to put little check boxes by their name. And we just reinforced that was definitely not the case. And after the fact, they all said that they felt that was true and they appreciated that. Because if we as the organization is not giving them the training they need, then we can't necessarily hold them accountable for that. So they used a McGregor fertilizer company site outside of Pullman, and they had big fun rolling this bus over. It's a Wheatland Express bus, and you can see the orange boxes on top. That's where the firemen wanted to cut the roof out so that they could get the people out. But then the windshield busted out when they started, and all the victims just started climbing out. So they were telling them, go back in. Observations mainly from our nurse that was the incident. Of how I'm supposed to do this. And I said, I stand beside you the whole time. I will walk you through this. If you're ever overwhelmed, we will say pause, and we will make sure you get to where you need to be, and then we'll hit the pause button and we'll move on. Because it was training, it wasn't testing, and once they figured that out, they were much more comfortable with that. So in our, or outside of our ED, we had a big concrete room. The clipboard kept with all the paper triage stuff. And how often does everybody train with that? Never? Yeah, so this was a good exercise for us, so we had them use the paper clipboards. And like, man, I've never filled this stuff out. But that's what you're going to do if you lose your computers or if you lose power, you're going to go back to paper. We have cross-trained staff to come to the ED. On that particular shift, the people who came to the ED really had minimal experience in there, so they really didn't even know where the supply room was. They didn't know where the extra oxygen bottles were kept. They didn't know where the extra small gloves were kept. So that was good feedback for us that when we cross-train staff, we need to be hypersensitive to awareness of just the supplies, if nothing else. Another big one was our staff didn't know how much to pretend. Because whenever you're doing a mock disaster, how much do you pretend? Do you actually cover the wound? Do you actually hook them up to a blood pressure monitor? Do you take their temperature? What do you do? And had a little bit of issues with that. And then the big one for us too is we had the lab coming in to do lab work, and the patient would not be in the same room that they thought they were in. And we have 6 ED rooms, and we didn't number the patients by room number. They were numbered by when they got here. So first patient might be room 4. So they were patient number 1 in room number 4. We found that to be pretty confusing. So we actually are going to buy a electronic status board that we can cross-track with our Meditech software program. And so that information will go up on the TV screen basically. And so we'll be able to tell by the initials of the patient what room they're in, what their status is, if they need lab work, if they need x-rays, CT scan, family to notify, and all that kind of stuff. So we're pretty excited about that. The triage tags went well, except for at Whitman, because of the logistics, they brought a van of our 8 patients to Colfax, and then when they started the drill, they brought them to us so that the drill could conclude at the same time, because there's about a 30-minute transit time between us and Pullman. But none of our patients had triage tags. And some of our staff were kind of caught off guard by that. They said, well, we thought we were going to have triage tags. And I said, what would you do if a van load of people came to the ED without triage tags? Well, we'd treat them. Okay, treat them. Do the triage yourself, figure out what they need, and of course they did an outstanding job. Like I say, the emergency management department of Whitman County fed all the firemen, and they thought it was great. And there was a bunch of folks here. This is not even everybody that participated, because nobody from the hospitals really came to the lunch, because they still had to stay there and do their jobs. But we figured there was 125 people participating, like I said, with 14 different agencies, not including, I want to make sure I get this out too, we had These are the non-emergency management partners. We had the Moscow Daily News. City of Pullman had road signs and cones. The Roller Hills Derby Dames acted as patients. Shawnee Rock Company provided the location. The McGregor Company provided location. McKiernan Brothers Auto Supply provided forklifts to push over the bus, and Pullman High School provided patients. So it was a multi-attended event. This is Mike Walker. He was the main organizer of the event. He did complete what I have here is his after-action report. I just got it yesterday. The organizing committee, we're going to meet and probably finalize this and then send it out to whoever would like to have a copy. So the question is, should we do this again? Should we involve more agencies? Because 14 was quite a number. And should we have a revolving location? And obviously, yes, we're going to do it again. Not only does it meet the requirements for CMS for all hospitals, but it's the right thing to do. And being from a very rural county, we have us to rely on when it comes right down to it. And we want to make sure that the first time we talk to each other is not during the event. We want to make sure we have these relationships built beforehand. That's what we're doing. Huge success. We're inviting anybody that wants to participate, whether it be anybody from the FAA, because they have, all airports need to have drills, schools need to have drills, hospitals need to have drills, anybody that wants to come. In fact, like Ed was saying, there's going to be a couple more exercises, the active shooter drill in the spring, and then I think the Moscow airport is going to have a airplane crash drill. That's what's on the plan. So we're going to participate in that as just an entity to receive injured patients from there, and I'm sure Pullman will do the same thing. Any questions? Yes, sir.
Bruce, this is
talking to that mic, would you please? Okay. Okay. The question was a large-scale exercise. What was the process to get it organized? Basically, we got together, had about 3 meetings, and said this is what we need to do. And each entity coming to the meeting said, we can provide A, B, and C. And the other guy said, well, I can do this and that and the other. And pretty soon it was pretty hard framework up. I know the administration of Whitman Hospital was on board with it, as was the administration of Pullman Regional and Gritman Memorial. So there was really no obstacles locally, no obstacles at all. It was almost odd how it came together. I know I called Travis a couple times and said, hey, guess what we're doing? He goes, do you realize how big a deal that is? And having never done it really before, we said, no, not really. Is it a big deal? He goes, oh, yeah. It takes most hospitals a year to plan this and thousands of dollars and 18 committees. And, well, we just don't have that. And so we had to make do with what we had, and actually it turned out just so much better than anybody could have ever hoped. We're thrilled with it, so we're going to keep going with it. Yes, sir. So the question was, within the committees, were we able to follow the timeline? So it's amazing how things are important. So we had Halloween that we didn't want to do this on, and some home WSU football games, which we didn't want to do it on. And then there was a couple other, and then one of the fire guys said, well, if we do it on a Saturday, we can get more volunteer firemen to participate because they work all week. And we said, well, that makes sense. And from the hospital perspective, Saturdays is historically when you are least likely to do a training because most of the exempt staff doesn't want to come in on a Saturday. So that's the day we picked, and it worked out great. The other thing that it did for the hospitals was it allowed the skeleton crew that you have on the weekends and nights to participate in something that's a little out of their norm because, again, there was no managers there to back them up. There was no administration to back them up. You didn't have ancillary staff there to back them up. You didn't have just extra people there. They had to do with what they had, and it worked out pretty good. Anybody else? Yes, sir. Pullman Regional is the DMCC. I can I can talk about the communication between the DMCC and Whitman Hospital was non-existent because somebody just forgot to call. As simple as that. Just forgot to call. The other thing that they had a pretty big takeaway from the after action report was we felt more people needed to have the NIMS ICS 300 and 400 course because the people that were put in those positions to fill those roles weren't quite sure about the command structure formats on how to talk to the other agencies and who they should be talking to. So that was kind of the big thing as well. WATRAC, fabulous tool, underutilized because our ED staff did not enter the correct information into WATRAC. That would have been nice to have. And so actually Travis and I are working on some training for that. But I will read a little bit of areas for improvement. Pullman, like I say, the DMCC was simulated but not actually activated. No communication from the hospitals, from Whitcom, or from the scene. That was an oversight on the drill setup. Not all ambulances called the hospital they were en route to tell them what their patient timetables were. I know the drill was supposed to start at 11, and we heard the drill start on the radio, and we got a call on the radio that said, yep, you're going to be getting patients in 10 minutes. And they were at our door 30 seconds later. I mean, we didn't even have the time to page triage to the ED overhead. We had nothing. Here they are. It was pretty funny. Another thing we realized that Gritman, just right across the state line from Pullman, they don't have WATRAC. Neither does the hospital in Lewiston. So that's another obstacle that those local hospitals have to understand is you're going to have to make a phone call to those guys instead of expect them to see it. I found out in our hospital that in one of our older wings that the overhead paging system hasn't been working. I'm waiting for the call and waiting. I'm like, man, I went to the ED. I said, what are you guys doing? Oh, we paged it out 5 minutes ago. Like, all right, mark that down for the IT department. But what I told people was, if you don't train and experience those types of things, then you don't know what you need to fix. And so even though we have a few handfuls of things that we want to fix, the takeaways for the positives far outweigh that. We don't call them negatives, and it's just things that now we know we need to fix and we can fix. But the community response with our community partners was incredible. Like I said, Travis was there. He did a nice job representing the Region 9, and he just couldn't say enough nice things about it. I mean, from the food, from the organization, the logistics, the amount of different entities that were involved, the volunteers that were involved. And this was December 3rd, so it wasn't like it was in the middle of summer. It was not a bluebird day. It was a winter day. Any other questions I can answer about anything? Yes, sir.
So you have your PIO charge of notification, not a traditional PIO responsibility. You have a PIO approved?
Actually, that was one of the instances that we realized nobody was identified. So at the scene, they felt they needed somebody to fill that role. Since we had patients going to 3 different hospitals, they had nobody to track that where the patients were going. So it was more along those lines. And then one of the things that Bill Whitman and I decided, we didn't want to overtax our staff with having to implement a PIO at our facilities because we didn't want to call a bunch of people in and things like that. We wanted to test certain things, and that's where our focus was. But we have also identified that our PIO could probably use a little more practice. Always more practice. Anybody else?
Hey, Bruce.
Yes, sir.
Did you have any idea of the percentage of strictly volunteer first responders versus full-time first responders?
I would say for the question was about percentages of volunteer responders versus full-time paid responders. I would say at least 80-20 volunteer. It was all volunteer. I mean, some of the, like the Colfax ambulances are paid, but there was volunteers that participated with that. The rural fire districts are all volunteer. They were the main players in that. Pullman Fire, they have a few volunteers in that. And that was the thing about doing it on a Saturday. All these guys that volunteer, they don't get to participate in the training like that as much, and because they can't get away from their day job. And so that was a pretty big takeaway, a positive for us. We allowed, like I said, it was over 125 people that participated. Most of them were volunteers. Like I said, we're a critical access hospital. Like, I don't know how many in here come from a small hospital, but money does not grow on trees in Whitman County. And we were able to do this on a very, very shoestring budget. I think the only budget was the food. Because everybody else just volunteered their time. MedFlight said, yeah, we'll come down. They used that as a training opportunity. So we're pretty happy about that. Anybody else? Yes, sir. Yeah, the question was when we brought volunteer patients to the hospitals, was there additional staff? And no, we used the staff that was on shift for that day. With the full knowledge that if we had actual trauma, that we would suspend the drill and take care of the patients. But it was incredible. We had at Whitman, we use weekend docs in our ED, we call them. They're contracted physicians that come in and they work the weekends. And I think her name was, well, I can't remember. Had a doctor there, and I kind of front loaded her a little bit, and I say, hey, we're going to have this disaster drill. Are you up? And she said, I've been a doctor 25 years. I've never done that. And she was fabulous. She was in it. She was running from room to room, checking patients and writing notes. And she said, we'll write all this stuff down, and I'll dictate it later. And she was a rock star. And she told me afterwards that was one of the funnest things she'd ever done. So we want her back for the next one. But one of the things that we really focused on is we preempted a lot of our staff with, this is training, it's not a test. You're not evaluated, we're evaluating our process. And I think that came through. Yes, ma'am. Did they know? So the question is, was the timing a surprise? Yes and no. I did talk to some of the managers, and of course the administration knew what day it was going to be on. And then we decided about a month before, every Friday we would send an email, a blast email to all the users in our email system that said, we're going to have a disaster drill, and we would include some education during each communication on what our disaster plan was located, what our staffing levels needed to be, whatever we wanted to put in there. And then they knew it was going to be on December 3rd, but they didn't know what time. So it was as much of a surprise as we could get. But of course, when I showed up as the safety security manager, the ED staff said, when is it happening? When? I said, no, what are you talking about? I'm just here to do some paperwork. They didn't bite at all. Any other questions? It was a great exercise. If you have an opportunity to do something similar in your community, I say do it. Myself or Bill Whitman, or I'm sure Travis, if you have any questions on organization, give us a call. We'll let you know whatever we can, and it was a great success. Thank you very much.